So little turn here for interior design, different discipline. Is everyone here a nurse or medical in some fashion? I think that's a yes. This is the first time I've presented this to someone in the medical field, so this is really interesting for us. These three people in the front row speak my language. So we'll move forward. So I'll introduce the study to you and kind of why this is important. I'll introduce you to Carilion Roanoke Memorial down in Roanoke, Virginia. Are you all familiar with that? Go over some of the literature, review my research and the data that I collected, and then review my response in the design solution of a unit at Carilion. So the purpose of my study was to explore the daily needs of nurses, what you all do, how you spend your days and your workflow, analyze current facility designs and determine new ways of designing that can hopefully impact stress levels and increase productivity. So why is this important? Well, healthcare is in a state of flux. It's changing the way that facilities operate, the way facilities profit, the way you all care for your patients. And it's really in the midst of a construction boom, and part of that is because of new legislation, and also part of that is because our population is aging and we need more space for our patients. And properly designed hospitals have the potential to increase staff effectiveness and really provide a higher quality of care to our patients. So this is Carilion in Roanoke. They have over 700 beds and a number of residency and fellowship programs. And across the street from the main facility is 2017 South Jefferson Street, and this is the space where I've redesigned a unit. So we'll go over some of the literature that I've reviewed. Probably not a big surprise that nursing has a high turnover rate, about 20% per year, and not only is there a high turnover rate, but fewer nurses are entering the field. And so why is that? Nurses are leaving for higher paying jobs, jobs with shorter shifts, and less stressful and physically demanding jobs. Well, as a designer, I can't give you a higher check and I can't give you shorter shifts, but we can look at the stress that you all face, and we can also look at how physically demanding your jobs are. Quality of care. The degree to which health services for individuals and populations increases the likelihood of desired health outcomes. As someone who's not a medical person, I've had this described to me as the best care at the least price, and that's the least price to you as the patient, and it's the least price to the facility, the hospital. So nurses can impact a perception of quality of care. So when your patients are leaving the hospital, they've been discharged, they take the survey, and they tell you how they felt. They perceive that their care was timely. They perceive that the space was clean. They perceive that they got a good kind of care. And so we want to be thinking about this, because this is how hospitals get paid by the government. If the quality of care that they give to their patients is good, then the government gives that hospital more money. So stress factors. A nationwide study found that in 2001 found that 70% of nurses rated stress as a top concern in their career. And those stressors from the physical environment come from noise, poor lighting, improper ergonomics, exhaustion, and lack of contact with nature. So let's look at a couple different forms of designing for nursing stations. So you all are probably familiar with both forms. But centralized station is that more traditional, more central station where they're a little bit bigger. They can seat 3 to 4 nurses. People are answering phone calls and taking care of paperwork. The benefits to those is that it's a collaborative space, it's a social hub, and it suggests to patients and family, hey, you can't come here, this is staff space, and nurses need that. The disadvantage is that it's noisy and crowded, and it's further away from patient rooms, so you might not be able to see your patient from there. So in response to that, architects and designers have been introducing decentralized stations into units so that they're closer to patient rooms, so that nurses can see their patients and respond to their patients quicker. But the disadvantage is that there are feelings of isolation, you don't have that central hub, and that private conversations can be heard. If you're talking about this patient over here can hear it. So walking patterns, about a quarter of a nurse's time is spent walking. So we can assume then that 25% of a nurse's time is spent not taking care of patient activities. And you all walk about 2 to 3 miles a shift. So how can we respond to that as a designer? How can we reduce the amount of time that you're spending walking and traveling? And part of that is just unit layout and positioning places and spaces in the right places in the unit. Ergonomics and back pain. Nurses lift about 1.8 tons of cumulative weight per shift, and that's either assisting patients in and out of a bed, into the bathroom, pushing your computer on wheels and other equipment that's heavy, and back strains, and your feet hurt and your back hurt. And so how can we as designers react to that and either give you all the equipment that you need or give you softer flooring for your feet, and attention to height of your workstation so you're not bending over, you have proper ergonomics for your workstations. Let's take a dive into patient room configurations. The industry standard has turned to single patient beds, and there are a number of reasons for that, but it's the reduce of infection, reduce of stress levels, there's privacy, your nurses can focus on individual patients one-on-one. And standardization of patient rooms, which essentially means that each patient room is identical to the other or close to identical. And that can lead to less confusion in the moment of a reaction. Some spatial configurations to think about, and using color as a wayfinding method within the patient rooms. So I studied some medical surgical nurses at Carilion on the 5th floor, and I just watched what you all do. I'm not a nurse, and so I wanted to study the morning shift and the evening shift, and I watched 4 hours of both shifts, and I just said, you all do what you do, and I'm going to kind of try to stay out of the way. And I watched how you all do your charting and you transition your patients. And a lot of times that happened in the hallway within earshot of other patients, and that was no fault of their own. They had no space to do it. I watched the transaction going to the medication or the Pyxis room back and forth to the patients and how that happened. I interviewed these nurses and I asked about stressors. I asked about productivity. What do you not have that you'd like to see from a physical perspective? And I surveyed these nurses about productivity and stress levels. So essentially what I did is, nurse A had the orange rooms, and nurse B had the blue rooms, and nurse C had the green rooms, and nurse D had pink rooms. And they cluster the rooms together so that their patients are close by. But what I wanted to see is, if your patient is over here, where are you going the rest of your time? And how is that time spent? So they spent a lot of time going to the nurse station, to the Pyxis room, which was extremely crowded. Doors are opening left and right for that medication, and people are trying to get out of the way. But protocol says you can only get one patient's medication at a time. So there's a lot of redundancy in the corridors going back and forth. And so I'm trying to think, how can we use space more effectively to reduce the amount of time that's spent walking? So this was the morning shift, same thing for the evening shift, and the charting happening both during those transitions. So I surveyed and asked, of these 8 attributes, what would be the most important things during your shift? And visibility of patient rooms was by far the most selected answer. So blue represents it's the most important, and red represents it's the second most important. So my takeaway is visibility of patient rooms, natural light, and sound control was important to these nurses. Attributes that would be likely to increase productivity, again, visibility of patient rooms, natural light, sound control, and having enclosed space. These nurses really wanted space where they could tuck away and get work done without a knock on the door from visitors or patients. Attributes to decrease stress, sound control, views of nature. You're kind of seeing these same things. And again, enclosed space, they want space to get work done. So my design solution. This is the floor plan that I took from the building. And as you can see, these had either 2 or 3 patients to a room. And I've made the decision to give each patient his or her own room. And I'll go over these kind of as we walk through the floor plan. But to get you familiar with the floor plan, what I've done is I've angled each of these walls in the patient room. So this angled wall is the head wall. And this is where the patient's bed sits. So as the nurse is walking down the corridor, she can get those quick check-ins as she walks down. And I'll give you all a little walkthrough so you can see kind of what that looks like. This gives you a perception as if you're a nurse. Okay, I see my patient, she's okay. I have a workstation outside of every patient room to jot down. There's space for my computer on wheels to be stowed and charged. There's space in the corridor that I can do some charting behind that glass partition. I hope you saw that. That was quick. Let's go back in here. So this is a perspective of the patient room, and the takeaways here is that there's plenty of space for the nurse next to the patient bed to take care of the patient, and the bathroom is located on the same wall as the headboard or where the bed is, so that patient can walk to the bathroom with an assist from a handrail. We'll give you a quick walkthrough of the patient room. Oh gosh, I knew that was going to happen. I don't know if it'll let us show it. Let's see. There we go. So there's room for the nurse, the toilet and shower on the same wall as the patient bed. And within the bathroom, there's no walking over into a shower, so a patient is less likely to fall. So 25% of patient falls happen either to or from or within the bathroom itself. Again, another perspective of that corridor, the nurse station. So beyond this blue wall is your printer and your storage for office supplies, and beyond that is some enclosed and semi-enclosed workspace for staff. And here's a shot of the Pyxis room. So there's plenty of space for a nurse and for doors to open for the Pyxis machine. And then beyond that is the nourishment area. So the idea here is that rather having a nourishment room and a Pyxis room, there are spaces that kind of open and talk to one another. So if I have medication in one, I'm not opening doors. I can walk through, gather a ginger ale and the medication, and then head to the patient's room. So here's a look of the corridor. So what I've done is applied some color, a graduation of blues that helps with branding, but also identity of each patient room. So each patient room isn't the exact same. I'm Bob, I'm not patient number 105. And then a close-up of that room, something we talked about as designers is how can we make it more individualized? And so what if it's not room 503? What if it's the dogwood room? What if it's the fern room? So providing some identity here beneath, or excuse me, right above your cow on wheel, your computer on wheels. So that's kind of the porch for each patient room. And I think I have one more walkthrough. This is the walkthrough of the core space. So the nurse station, some office supplies. Beyond this is the semi-enclosed, so there are windows open to that space. Fully enclosed workspace, doors leading into the Pyxis room, and then an opening into the nourishment room, and then move right out the door to go to your patient. Any questions? Uh-huh.
The angulation. The one problem that we found is that when we're actually transporting patients from stretcher to stretcher, like for transporters, they made the angle too small, and the transporters couldn't get the stretchers in easily with the bed, and there was not enough room working around the beds to transport.
So do you mean through the doorway or within the room itself?
So within the room itself.
Within the room itself.
Okay,
that's good to think about. I haven't addressed that. There is an extra door that opens, so that you have about 48 inches of doorway to get a stretcher and other equipment in for bariatrics or equipment. And there is a good amount of space in that room. I don't know if there's room for a stretcher to lift a patient into that bed. That's a really good point.
And for people to get around.
On both sides, yep. So the patient chair is on casters, so this is the patient chair. So this can be moved anywhere in the room. Yes?
You could talk about before getting into your design that each room had 2 to 3 patients per room. I think you said
The original facility.
Are you adding additional rooms so you can still get the same number of patients in?
No, and the reason I didn't do that is first I focused on one unit. So I've only focused on this floor of this hospital. But my argument to that is if it's true that patients heal quicker and there's less risk of infection and that nurses are more productive in one patient rooms, then the hospital is still making money, right? Because that patient is leaving the hospital at a quicker rate, if that's true. The patients are leaving at a quicker rate and then they're not returning a week later because they're still sick. But good point. We talked a lot about that. We did. Yeah. Is it typical for designers to work with architects for a hospital?
When they're building a hospital.
Yes, it is. So I work with AECOM, which is a firm. It's a global firm, but I work in Roanoke, and we're actually working on some Carillion units, not this unit. But yes, designers and architects work together, and we collaborate, and we say, what are the spaces that we need, and where should they be laid out, and how do you walk to those spaces? So yes, that's exactly what we do. And there's a team of architects, and there's usually a team of designers, and everybody kind of collaborates. And that's exactly why we're employed. Yeah, that doesn't surprise me. It doesn't. Yeah, whoever, yes? In the corridors, this is a sheet flooring that is, oh, sorry, I'm speaking design, medical surgical. I was like, that is a really interesting question from a nurse. Yeah, that's a good point. And the unit that I watched had, I think, 18 beds. So that you're right, there's a big difference. So this was not originally designed for a medical surgical unit. This was originally designed as a rehab unit. And the reason I chose this space is because this is the unit where my grandfather passed in 2007. So it kind of had a personal space for me, and that's why I wanted to move with it. It probably would not be a medical surgical unit. Yes. If I heard your question, it was about extra equipment in the ICU. In the ICU, is that right?
Yeah, my thing was, if I was to put a patient in that room,
Well, this is not an ICU unit, so it's not.
the patients on that on those floors, med-surg floors, when they come critical patients, and we would have to actually
Would you be able to get in extra equipment? I don't know what size this equipment is, but my response to that would be the extra door. So both doors open, so you have about 48 inches to get extra equipment in. Just depends on the size of the equipment that you're talking about. I know that these rooms are substantially larger than the rooms that existed in the building. So my response would be it would be easier to fit it, but I don't know. I just don't know. Yes.
I want to say thank you as a nurse. To see someone put this much thought into it and watching it, I think it's awesome. I think I can speak for a lot of the nurses in the room when I say, like, we don't get to see this side of things very often. I actually work in an outpatient setting, so it is completely different. We do endoscopy and colonoscopy procedures, which you guys are going to hear a whole lot about in about 5 minutes. And this is totally random and may not be in your element. It may be more for like an electrician. But in our 2 centers, we've actually had recent redesign and reconstruction. And the thing that always gets me is there's never enough electrical plugs.
Really interesting you bring that up, and it's something I would have never thought about. But the nurses that I interviewed said, we have these computers on wheels, and they are always running out of batteries because we want to charge them in the patient room, but the patient has his iPhone plugged in and the iPad and the whatever else. So outside of every patient room is a charging station to charge outside of the patient rooms, and there are additional plugs on the inside. And then in addition to that, in the Pyxis room, and in some of these huddle rooms, there are extra spaces not only to store the cow, but to charge it. So especially up along this wall.
Great, thank you.
Yeah. Mm-hmm. Yes. Oh, I'm sorry. Go ahead.
just that we're really into safe transfers these days.
Okay.
And about mechanical lifts. Would there be the capacity in these rooms for those to either be kind of permanently installed?
Are these ceiling lifts that you're referring to? Yeah, I thought about including that in the room. Some of my studies showed that there's kind of a push toward not having that because it's scary looking. And a lot of patients don't want to see that up in their bed when they're trying to go to sleep at night. So I didn't include it. But it's something that could be addressed in the ceiling plan, which I did not include in this presentation. It could be added. So above each of these beds is acoustical ceiling tile, and there could be, you know, there could be some sort of attachment for some lifts. Yeah.
This will be the last question.
I just want to ask, did you look into what joint clinicians, like their standards, I know like with the nutrition room and fitness room, we're not allowed to have food, drink anywhere near medications, so I don't know if the open flow is to their standards.
Good point. All I know that code requires is in the nourishment room, if it's not a food prep area, code requires a refrigerator, a microwave, a sink, and a workstation. It did not mention that it couldn't be attached to the Pyxis room. This is not a food prep area, though. This is just ginger ale and crackers.
Thank you.
Yeah, thank you.
Thank you.